how could governments take meaningful action, particularly in handling methamphetamine right now in light of COVID-19? And indeed all drugs. Let's not like all drug classes, because you touched on it before. We've got every year approximately 200,000 people cannot get access to any sort of rehabilitation or outreach service. What do you think governments should do now that we've got COVID-19? So we're adding anxiety, depression, poverty, job losses to an already buckling sector. What could they do now?
Well, I think, when the data is in, we'll find that it's not only consumption of alcohol that's increased massively during the COVID-19 restrictions, but also illicit drug use. Now that not only has a social, emotional and health impact on our communities, that will have a huge economic impact. So, I think there are a range of arguments that need to be put before governments to take a more aggressive harm minimisation strategy that goes beyond, posters on clinic walls. We definitely can't afford to dilly-dally around with drug users when our medical resources are now stretched in a pandemic. And drug users, of course, especially super drug users, have no regard for other people. And in a time when we have to live with restrictions to prevent the transmission of COVID-19, the necessity to use some more coercive strategies to prevent COVID-19 transmission by super drug users, I think, will have to be considered. Awareness in the community of the dangers of illicit drug use needs to be increased dramatically, because with everybody in lockdown, what goes on in the family home is in the private domain, and therefore not subject to the purview of legal enforcement or the public. But, we live in a time when actually the small-time drug dealers in every community will become more desperate because of our economic difficulties, and unemployed people will become more desperate. So, drug dealing is a go-to occupation, a means of earning some income for people without skills. So this presents an enormous threat to the community, and we'd better start coming up with some smart diversionary strategies.
Yeah.
Most people don't think at a population level, they think at a purely individual level. Most people can't think in public health terms, in sociological terms. So that's why, we've had such a difficult time stopping people going to beaches and partying during the COVID-19 response. Yeah. They just don't get it about virus transmission. People don't think sociologically. And so it's up to those of us whose job it is to think sociologically to keep putting the arguments out there and to raise our voices, because your average politician, your average cop, your average drug dealer, your average codependent cannot see the big picture.
Yeah.
So we need information, we need good research, we need better policy, and we need to be good advocates.